Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and I have with me in the studio Dr. Emmanuel Alhassan, the head of Department of Psychology, Nasarawa State University, KEFI, and then he is the chairman of the FCT chapter of the Nigerian Psychological Association. We are having chairman of psychologists here. You're welcome.
Thank you so much.
Great. Dr. Alhassan, it's wonderful to have you in the studio for our discussion today. We've been collaborating between your department and Terra and what we are trying to do with psychotrauma healing courses here. But today, we are to discuss level of psychological awareness in Nigeria. We have had your colleagues here, a number of your colleagues here, and we all do agree that Nigeria as a corporate entity is traumatized.
Absolutely.
Heavily traumatized.
Absolutely.
Every day, I don't know how many people can sleep with both eyes closed. You hear of deaths, and we're now hearing of deaths, not of individuals, but hordes of people, communities, 50 people, 100 people. I mean, oh, this building collapsed and so many people dead. Bandits came to a place and took 400 children from a school, 300 children from a school. And nearly 1 year after, we are not hearing that all the children have been released. Leah Sharibu is still not accounted for. Or we hear that, oh, last year or 2 years ago, 100 students were taken away. But today, some women and children are being released, meaning from those students. They have been married by bandits, and they have been raped and serially raped, and now they are pregnant, or they actually have babies are coming. I'm just imagining the trauma that people are living with. Then, what is even the level of psychological awareness of the average Nigerian? See the way we drive in traffic. To drive out, and you go to KEFI from Abuja, to go to KEFI and drive through the Nasarawa roads, through the Nyanya, Maraba, Karu roads, and One Man Village, and so on, come back. It must be hectic every day, just navigating through. Not to talk of people going to the market, not to talk of the noise pollution all over the place. I'm waking up with some prayer sound. I go to sleep, some sound, party here. I really wonder our level of psychological well-being as a society. What do you have to say?
What you are saying, what you have just described is reflects exactly what is happening in society. And the other very disturbing and concerning side to it is the fact that a lot of people are walking down the street. A lot of people are driving cars. A lot of people are commuting in taxis, in buses every day, and they are not even aware that they have a low level of psychological well-being. A lot of people even now have psychosomatic illnesses, which now impacts on their physical well-being based on the psychological trauma, depression, some subliminal, they don't know about it, and then they have high blood pressure, they don't even know about it, and that's why you have sudden deaths. That is why you have people acting aggressively, even without thinking. That is why, for instance, a few weeks ago, a friend of mine is on the highway, and then a gentleman just matches his brake in the middle of the road. And then my friend hit him. Luckily, he wasn't, but he hit him all the same. He comes out, and the gentleman, what happened? What happened? Why did you stop suddenly? And he said, I am sorry. I really don't even know.
I didn't know. Yeah.
I didn't know what happened.
Until I heard the bang, I didn't know.
So we are at a stage in our corporate existence in which we need a lot of psychological intervention. And I'm, very, very happy that government, and particularly the office of the head of service of the Federation, coordinating her colleagues in the states, have now actually passed into, the civil service structure a cadre for psychologists. That happened, that was the good news before the year ended in 2021. This is something that is very great, and what now just is left to be seen is for how government can now actually operationalize that. Mm-hmm. Because we need psychologists. We need psychologists in schools. We need psychologists
everywhere. In every institution, organization.
And that's why we're also delighted that even in the paramilitary, for instance, last year, the NSCDC, has instituted a program where they actually assess people, who come. The same thing with the Nigeria police. That has started gradually.
Psychological. It was one of the demands of NSAS, psychological assessment.
And in fairness, the Nigeria police has started that program, but a lot needs to be done. There still needs to be a lot of training. We also need, programs like HEOS to look at health workers who are not necessarily psychologists, to be given some rapid...
To be equipped,
to give psychological first aid if you... And then for the more serious issues, they need to see psychologists. Mm-hmm. And where it becomes so psychosomatic and other issues are involved, then also see psychiatrists. So we also need people to learn coping skills, to learn resilience. I did a study a few years ago on coping and resilience among internally displaced persons at the Durumi camp.
Yes.
And it was very revealing, very, very revealing. You could see that some people who were, first of all, we found out that the intensity of an event that caused this displacement, the level of intensity correlated very highly with the level of post-traumatic
impact,
stress
the
disorder,
level of impact. The intensity.
And all of that. And then we also discovered that over time, those who had received some counseling, those who are able to cope better, are able to have a better level of psychological well-being, than those who had not received
who have
such
been left on their own.
So a lot needs to be done. I agree with you, absolutely.
Wow. Now, tell us more about this cadre for psychologists that you say has come out, have been approved by government, because I know that universities have trained thousands of people in psychology. Thousands of people have BSc or Masters in psychology.
Yes.
But they're working in the bank, they are working in some corporation, they are working whatever. You took your own and you went to work in some bank or in some oil company for many years before you came back home.
Absolutely.
So thousands of people, because there was no, it's as if government said we didn't need you. It's as if Nigerian society said we didn't need you. But right now, we are having a lot of people ending up in rehabilitation homes.
Absolutely.
Perhaps some of those could have been helped if, when the confusion was beginning, there was some counselor, trained counselor to help them through.
Absolutely.
So our hope is that with this new recognition, that various organizations and institutions will begin to employ among their staff trained psychologists who will accompany the staff. It will be part of the human resource department to have a psychologist.
Absolutely.
But I'm told that, is it because there was no cadre for psychologists that even federal health centers and teaching hospitals were about the only ones that often had psychologists?
Yes.
Most general hospitals in the country didn't have.
No, they didn't have. And up till now, even as we speak, they still do not have, because the awareness of this cadre, is not very high. And I think all stakeholders need to do that advocacy for there to be increased awareness, for Nigerians to understand that their psychological well-being is as important if not more important, because you can be healthy, you can have all the cars in the world, you can have all the money in the world. If you're not mentally healthy, you're not psychologically sound, then of what use are those things?
I mean, the whole mind-body connection, if the mind is not at peace, if the person is carrying trauma from the past or negative experiences that have not been reflected upon and dealt with, then very soon the body itself will begin to disintegrate.
Exactly. And so it is very important that government, and again, we really appreciate, the NPA really appreciates that great stride by the government, by the office of the head of service of the federation. So the next stage now is, how do we ensure that the Federal Civil Service Commission now actually actively then begins to get psychologists to do what they are supposed to do? How do state governments, how do private sector organizations begin to integrate psychologists? In other climes, even at the workplace, just like you mentioned, you have psychology. And, funnily, if you look at some of the top-notch consulting firms in the country, they actually use psychological instruments to do their recruitment.
Oh, sure.
So if the big corporates use them and they use psychological instruments, we can expand this. And we can go beyond just the selection, of
accompaniment, to accompany them.
They should be part and parcel of every human resource process. They should be part and parcel of, periodic evaluations, just to be sure. They need to be part of because issues, people have emotional issues, people have marital issues. They work in a bank, they work in an oil and gas, they are teachers, and then they bring this to the workplace.
Yes.
We need psychologists who can help them. A lot of them also engage in substance abuse. You see,
talking about that is a whole new chapter of its own. Not long ago, NDLEA came out with the fact that 40%, their own statistics, 40% of young people are on one banned substance or the other, one substance or the other.
Yes.
Then a few weeks after that revelation, I had a meeting with a group of university students, University of Abuja students, and I sat down with them, and they said to me, these students, their own opinion is that this figure is conservative.
Wow.
That they think that when it comes to university students that they know, they think it's between 70 and 80% of young people that are on drugs. It was frightening. They said, no, it can't be 40%. From what they see, this cannot be 40%. And I said to myself, let us even imagine that it is 40, 50%. If every other young person you see is abusing one drug or the other,
the country is headed for disaster.
For disaster.
And that's the awareness. That's the point that needs to be really amplified. Right from the homes. Parents need counseling. Parents also need counseling with regards, to how to train their children in a digital age, in an age where you leave your phone for a 6-year-old, 10-year-old, and then he or she has access to all kinds of things.
And can go on internet. And
then you have smart TVs.
Yes.
You leave your children at home
with Wi-Fi.
With Wi-Fi. So there is a lot that needs to be done. This transition from the analog over the years to where we are today has not been managed from the psychological point of view. That is another area that, we did another study on even internet addiction. It is an addiction.
Oh, seriously?
And so we have all these sort of things. Parents need psychologists. Children, schools, by the time you transit them from your homes and they begin to go to school, the few hours they spend at school, in fact. And then by the time they now transit to boarding schools, the challenges we have today, the roots of this start.
Children are getting less and less mature, and they are going into school. They are leaving hope at earlier and earlier age. So
without the proper foundation,
yes,
without the parents, like it used to be, I mean, parents didn't study psychology, didn't know much about psychology those days, but they give children strong foundation, self-concept,
resilience,
self-awareness,
and resilience,
coping skills,
yes,
assertiveness, the ability to say no politely.
Yes. Yes.
I'm not interested. So the first time somebody comes and says, try this cigarette, you say, no, thank you. And you are polite about it, but you are firm. This training, as a matter of fact, what you indeed see these days is parents take you go to a garden at 11 p.m. Maybe you have a birthday party somewhere by this, or you have something. You see parents at 8, 9, 10 p.m. with children going to public places where people smoke, where adults are doing all sorts of things.
They don't seem to know the implications of all that.
You see parents look at, the TV or social media, and they say, oh, this particular celebrity has bought this kind of dress for their daughter. They go order the same kind of dress. And a young child grows up and by the time they are teenagers, and then you begin to have problems on your head, you begin to blame either the devil or blame, because one other challenge you have in Nigeria is that a lot of people have a high external locus of control. Rather than looking inwards and taking responsibility for the outcomes of their lives of what showing on their children, they now begin to...
They call the devil.
And then they also start blaming other people.
Yes. We are very good at outsourcing our responsibility. A lot of the problems that we are seeing with our young people, we caused. Parents are absentee parents. Many parents are not involved in their children's lives. We at Terra, we have all kinds of programs for secondary school young people. And each school we go to, we go with counselors. And we discover that they have tons of problems. Tons of problems that if we are there for 2 weeks, we'll be busy every day. Because the parents don't even know their children.
They don't.
They have no idea what's going on in the life of their children. And then when it comes to university level, many of these young people are abusing drugs. Some are prostituting. Others are literally living like husband and wife, but they are innocent young children in their homes. So the parents have no idea. And they themselves are living with that contradiction that my dad thinks I'm a wonderful girl or my wonderful boy. They are living with the contradiction, which already is going to cause problems.
It's challenging,
yes.
Psychologically
challenging. When you are living a lie, when you are living false life, then definitely you cannot be healthy psychologically. So it's a real challenge. You are saying we will be needing, let's say in schools, right now what we have in many schools are guidance counselors, people who read education and who read guidance counseling as a unit in education. That's not the kind of skill. We're talking of a more serious skill.
Absolutely.
So many schools, that's schools that even have guidance counselors, because the kind of problems coming up now, they won't be able to help. They can't help a 15-year-old who is already addicted to internet. The guidance counselors in our schools are not able to help. You need greater training. You need a
teenage girl is being disturbed by males in the dormitory after hours.
Yes.
You need a trained counselor, not just a career guidance counselor.
No, not career guidance counselor.
A boy is being bullied. He doesn't know where to turn to. You need trained psychologists.
The boy has been warned not to tell anybody. If the boy manages to go to tell a psychologist, clearly you need somebody who can help such a boy. And all kinds of problems all over the place. that schools need, churches and mosques need counselors, need trained psychologists.
Exactly.
Like we have, so that people can be sure that if they go, they have somebody they can talk to, and if they need the referral
who
services,
is well trained, who is professional.
yes, and if they need referral services, they know where to refer people to, and workplaces everywhere. So we won't in the next 10 years we won't have enough psychologists.
I dare say that even as is, if the psychologists that have been trained today are engaged, they are not even going to be the same challenge we're having in the medical field. That's the same thing, if not even worse.
Yeah.
Because you cannot begin to imagine. You see, there are a number of us who practice. A number of my colleagues practice. Some of my students who finished years ago, in fact, there's one who before he even finished, because of his skills, was engaged. And you cannot begin to imagine how many people need help, have visited these few facilities.
Professionals, yes.
They are overwhelmed. There are so many issues to deal with. You see a lot of people, a lot of big men, a lot of big women, and that's another angle that people aspire to be like.
Yes.
Some of them will want to trade your position with you, if they could.
If they could.
There are so many issues.
Because they are there, but they are suffering. They would wish they are not even in the limelight. They would wish they can get their childhood back and live like simple people. But it is not possible.
So we really need to begin to utilize the psychologists we have more fully, and we actually need
more, a lot more.
As the good book says.
Yes.
The harvest is
rich and laborers are few. And then we, organizations like our own, Terra, we are trying to just fill
bridge the
gap. Some courses here and there, to like our course in trauma healing or psychological awareness, basic first aid, psychological first aid, basic trauma healing skills, so as to equip people who are doctors and social workers and professionals like that, psychologists, doctors, give them special skills.
Yes.
So that they can help more wherever they are. The person could actually be a teacher or could be an engineer, but if he has those skills, then he can help the next person.
Yes.
So my hope is that with this new awareness, you are FCT chairperson for MPA, Nigerian Psychological Association. What are you all doing to have this kind of media exposure, a lot of it? Because we need a lot of traditional media exposure, social media exposure.
Absolutely.
What are you people doing to make sure that the media is on top of their game when it comes to making the public aware that these are serious issues?
So what we have done in the past few years is to ensure that we engage the media, like the World Mental Health Day, and other such occasions. We ensure that we talk about these issues. We're usually on print media and also electronic media. And the good news is that we have a new national president, Professor Olukayode Afolabi. And one of the things he has talked about and he's going to focus on is to actually now come up with a media strategy that would really expand expand our horizons in terms of making Nigerians to know exactly what we are doing as psychologists, talk about the issues, and so hopefully as the months roll by this year, there should be that will be unveiled. And hopefully there's going to be more media,
and we
advocacy.
We need the generality of the public, all those who are bloggers and social media influencers. We need you all to help us to let society know that this is an urgent assignment. People should know that we have serious psychological issues and we need that profession, the psychological profession. We need it in every sector of our society so that it can help people. On this note, I'd like to end this segment of the program. I've been speaking with Dr. Emmanuel Alhassan, the chairman, FCT, chairman of the Nigerian Psychological Association and head of Department of Psychology at the Nasarawa State University, KEFI. Thank you for coming.
Thank you very much. It's a pleasure.
Thank you.